In Maple Ridge and Pitt Meadows, we have over 10,000 patients seeking a family care provider, many of whom have complex care needs. Our Ridge Meadows Wellness and Urgent and Primary Care Center fosters patient attachment and access to services prioritized by local physicians and nurse practitioners.
Practicing at the Ridge Meadows Wellness Center is different than other primary care contexts.
Comparing with my old practice that was like in Newport Village in Port Moody, a very busy practice, it's a difference like between sky and earth.
The beauty of our center is that we have the ability to have a full team sort of practice.
And also the most important is actually that I work with a team that cares about my patients and help me around to achieve the best care for my patients.
This includes seniors, maternity, child and youth counseling, Indigenous cultural supports, and adults living with chronic pain, chronic disease, and mental health and substance use challenges. The Wellness Center co-locates a primary care clinic, an urgent care clinic, and allied health and specialist services, including much-needed space for education and rehabilitation services. Family physicians and nurse practitioners across Maple Ridge and Pitt Meadows refer mild to moderate patients into the allied health and specialist services located at the Wellness Center so that they can access specialized support from social support and navigation to prenatal education.
I didn't know anything until I came to here about what does it mean to work with a team-based primary care.
We have the opportunity to access the full PCN allied health services, from chronic pain teams to seniors teams to social workers and other RNs, mental health teams. So we really have a really well-rounded team approach to primary care here.
We have a nursing practice, me and my colleague Fiona, the nurse practitioner. In the morning we discuss each case and see like who are the patients who need to have like a clear input before we go in the room or after we see them. That's a new aspect to the practice. I had to get used to that because I used to do everything for my patients, and then I actually have to change my mindset for that.
An exciting part of the role at the primary care center is that the RN is encouraged and expected to work to their full scope. It just allows Dr. Rusu and Fiona to spend the time with their patients who really are needing them at that moment.
The impact of this model of practice in terms of a team practice means that everybody is working to full scope to help the patient. So what we're doing is we're surrounding the patient at the center of care with the appropriate team members to fully support them in their health.
When I was originally diagnosed with diabetes, it was really overwhelming. It's obviously a lot to learn and take in right off the bat. So it was really great to be able to come here and have all my doctors and specialists in one place. I didn't have to add the burden of having to travel outside of Maple Ridge to get the care that I needed.
One of the things I find very supportive for the patient is that they know that they can be working with the social worker, they could possibly be working with the physio at the same time, maybe the occupational therapist, and that we're a closely knit team and that we talk to each other.
So it enhances the communication about patient care in a huge way. I think the setup of this center with a salary-based model rather than a fee-for-service-based model allows for us to have the time to actually spend with patients.
For me, just the fact that I switched to the alternative payment plan, it made a huge difference in my personal life. I'm really glad that I got to this point where I can really enjoy working as a family doctor and not being pressed by the business aspect and running through the appointments just to make sure that I can afford to keep up the clinic. And the fact that I can allow for myself to have a day just to deal with paperwork, I can get home earlier and I can spend time with my family, which is very important for me. I believe that should be the future of the family medicine.
As part of this care hub, practitioners in the primary care clinic can enjoy a turnkey ready practice, clinical and operational leadership, medical office administration, site support, and a medical director are ready to support you. Come join our team. Come join our team.